Taoiseach, there's a lot of issues that will have to be dealt with in the COVID inquiry, but there's certain things that I think are beyond question. The Irish Health Service is operating at near 100% capacity. Most countries in Europe operate at about 80 to 85%. If we are hit with further public health emergencies or major accidents, unless we have a buffer within our health system, which means additional capacity, so we're not tipping over the edge on a day-to-day basis of the ability of our system to cope, we will be in very serious trouble. And all the hardships that we saw during COVID, we could be seeing again. So what are you going to do to ensure that we get ICU capacity is at the same levels of the rest of the European Union when it's well below? Isn't it time to recognise that having a fragmented, half-privatised system is not the way to maximise the capacity that we have in our health service, but we need an integrated, national, publicly owned and run health service rather than the fragmented, partially privatised and fragmented system that we have. And lastly, when you consider that staff are the key to increasing capacity, isn't it very, very counterproductive that the government are holding out on giving public service workers, including nurses and other health workers, a decent pay increase to entice them to stay and work in this country and in our health service when many, many of them are leaving because their pay, their income, as you referred to earlier on, is insufficient to give them a decent standard of life and afford accommodation in this country?
Just in relation to health service capacity, I agree that our health service needs more capacity, not least because of our rising population, our ageing population, and the development of new treatments. But what Deputy Boyd Barrett didn't acknowledge is that's exactly what this government has been doing now since 2020, in the 3 or 4 years since we've been in office. So we've 20,000 more staff in our health service now than we had in 2020. Yes, there are people leaving, but there are way more people joining, 20,000 more in fact. We've 1,000 more consultants than we had in 2020. We've 1,000 more hospital beds than we had in 2020. We've more ICU beds, and yes, you're right, we're going to need a lot more. In terms of nurses, we're now in the top 5 in the Western world when it comes to practicing nurses per head, even higher when it's practicing nurses per bed. And for the first time that I can remember, in the most recent statistics, we're now around average in terms of the number of doctors that we have. We had been below average previously, and there had been pay increases, and we're in negotiations with public service unions about further pay increases. We would have liked to have that agreed back in October, November, but hasn't been possible. I do think that the utopian system that, or perhaps the ideal system to be fair, that Deputy Boyd Barrett describes sounds very like the NHS to me, which might have been a model that would have worked 50 or 100 years ago, but doesn't work in the modern world. And what do we see in the NHS? Longer waiting lists and waiting times for patients, lower life expectancy, worse outcomes when it comes to stroke and heart attack, for example, and lower pay for the staff. So that is definitely not a model that we'll be following. And in the election, we'll be encouraging people not to vote for Sinn Féin and for left-wing parties, precisely because that's what they want to do in Ireland, and it's not a good thing. In relation to long COVID, the HSC identified early in the pandemic the need for a national service for long COVID and to set up a multi-specialty, multidisciplinary team to develop an interim model of care under the auspices of the Chief Clinical Officer. The model of care is now being implemented, building on existing service provision, in addition to establishing new services across GP, community services and acute hospitals to ensure a national service is in place for those who need it. Funding for the model of care has been increased to 6.6 million this year. At present, there are 6 long COVID clinics and 7 post-acute COVID clinics that are operating nationally. And what I might do, just in the interest, well quite a long reply, but I'll continue for it now. The clinics currently operate in St Vincent's, Beaumont, and the post-acute COVID clinics operational under the new model of care will be in the Mater and Connolly Hospital in Blanchardstown. In addition, Tala, James's, CUH, UHG and Limerick are operating combined post-acute and long COVID clinics, and HSC is working with Letterkenny to have a more definitive timeline around their anticipated launch date. Recruitment, which includes consultants in the areas of infectious disease, respiratory medicine, psychiatry, neurology and allied health professionals, and clinical psychologists and admin is underway. To date, 66 WTE primary notification numbers have been issued across all of the post-acute and long COVID clinics. And as of the 8th of September last year, 46 whole-time equivalent posts had been followed. And I think deputies would appreciate that long COVID is an emerging area of medicine and expertise, and still so much that we don't know about it.